Welcome to another episode of Ad Hoc with the Doc. Hi, I am Dr. Dan Rubin, back again for another episode here with Dr. Jeff. Oh my God.
Go ahead, go.
Oh. Anyhow, so as always with Ad Hoc with the Doc, we're here to serve up fresh answers to the questions that you have. You can help generate the content by writing in and asking us a question. We'll do our best to answer questions as they come in and in the order that they come in. But again, we can't give any direct personal medical advice or individual medical advice, but can answer general questions about health. And for this episode, bioidentical hormone therapy. So we had a couple people who said that they couldn't make it, as always, and they've written in some questions. But first, let's talk about bioidentical hormone therapy. So one question that I know that our front desk gets asked about bioidenticals is, how do you know if a doctor is competent or good or successful? Or I don't know if success rate is really it, but how do you know if somebody's trained or in it? And then let's talk about what bioidenticals are. So let's start with that. What does it mean to have a bioidentical hormone? Is that different than other types of hormone replacement therapy?
Yeah, so when we talk about bioidentical hormones, what we're really talking about is a hormone that looks the same as the hormones that your own body makes. So we want it to look like that structure, that molecule that your body would make naturally. And so sometimes I think there's a confusion between, people think bioidentical equals natural. And that's not necessarily true. For those of you who are familiar with a drug called Premarin, which was a very popular hormone therapy for a lot of women for a lot of years, that's actually a naturally derived...
from horse urine, right?
Yeah, it's from horse urine.
So what does that mean? They were taking hormones out of horse urine and giving them to women?
Yes, and so what the problem is that there's a lot of estrogens that horses make that we don't make.
Why would
as
we want
humans? We wouldn't, and there are problems with that, and they found that it increased your risk of cancer. So just because it's natural, right, doesn't mean that it's safe or effective.
That's a great point. Just because it's natural doesn't mean it's good, safe, or effective.
Right.
Which means people that may be going to the health food store and saying, I have this diagnosis or that diagnosis or I have an imbalance, is asking essentially a clerk who doesn't have a degree and sometimes might just be there after high school as a job for advice. Just because it's natural doesn't mean it's safe or effective.
Right.
It's a great point.
Yeah.
For all the listeners out there, it's a great point.
Yeah.
Okay,
Yeah,
so
and so in terms of hormones, I want to be able to measure the hormone in your blood. So I want to give you the main hormone that I can measure in your blood and that your body recognizes. So for example, estrogen. The main hormone I'm concerned about is estradiol, because that's the one that's going to be most biologically effective for
estradiol.
Estradiol, so E2. So that's the main estrogen. There's also estriol, but that's more of a minor player. For progesterone, usually what I'm going to give is something called oral micronized progesterone. There are drugs like Provera, which are a synthetic progestin. Those are not they're not the exact replica of what your body makes in terms of the progesterone
So it's not
molecule.
bioidentical.
Right.
So
it's not
bio means
bioidentical.
like biological, identical means the same as.
Yes.
The same as our biology.
Yeah. So that's what I'm trying to get. I want to mimic what the body makes.
Because that's safer.
That's safer. Yeah.
Okay. Well, we had a question from Margaret from Michigan and said, why is it that so many people seem to have hormone imbalances?
Yeah, that's a great question. It in terms of things like menopause, right, that's a natural life transition. So we would expect there to be changes in terms of hormones. But, we're also seeing a lot of hormone imbalances in younger women. And, there's a lot of causes for this. There, a lot of lifestyle issues like high stress, poor sleep, diet issues, I mean, people don't realize
Talk
how
about that. That's
influential.
interesting. I don't know much about that.
Yeah, you know, you think about, you know, what, you know, we need the raw materials to make hormones. So most of our sex hormones are made on a backbone of cholesterol, which I think most people don't.
Oh, I know where this is.
Don't, you know, they don't understand. So if people are, you know, restricting, for example, fat intake, people are, you know, maybe eating, you know, poor quality fats.
So do both good and bad cholesterol make hormones? Because people, you know,
well, cholesterol is neither good nor bad. It's the lipoproteins that it's packaged in.
Indeed.
So.
Indeed, that's
yeah.
really good for the audience to know. Because
Yeah.
there was a period of time where foods were being marketed as no cholesterol,
Right.
and we
right.
make cholesterol,
Yes,
right.
we do make cholesterol.
but we also need some
yes.
from our diet.
Mhm.
Okay.
Yeah.
And so, what about people on like cholesterol lowering drugs? It's a pretty
Yeah,
big
that's
industry.
yes.
Do they generally, like somebody who puts somebody on a cholesterol lowering drugs? Have you seen in your practice that physician then takes into account the effects on the hormones?
Generally, no.
No. Okay.
Yeah, and we know that statins are not that effective in women.
Okay.
So it's only a very small subset of the population that statins seem to have a beneficial, you know, effect for. So
Let's go back to that other question that we were talking about. Is what makes a good doctor? How do you know a doctor knows, even if somebody's out there and they want to undergo bioidentical hormones, or they think it might be right for them, how do they interview for a doctor?
Yeah, that's a really good question. One thing I would want to say is that, you know, hormones are, you know, bioidentical hormones are simply a tool, right? And they're just one of the tools that you have. And so if someone if that's their only tool in their toolbox, then I would be questioning whether that doctor is right for me. So are they looking at things like your sleep, your stress, your diet? Are they looking at, you know, environmental influences? We know that there's a lot of things in the environment that look like estrogen to the body.
Yes,
people are, you know, they're putting on body care products, they're being exposed to plastics in their food, and that those estrogens that they're picking up, you know, they're really detrimental to health. And you know, from being in oncology,
it's big.
I mean, it's...
You're talking about something that people may see is called a xenoestrogen.
Right.
And so are those at all bioidentical?
No.
Or are they just identical? Or somewhat identical?
They're attaching onto estrogen receptors, and they're incredibly dangerous and detrimental to women's health.
So from what I know, you have on a cell, like a breast cell, you have an estrogen receptor. An estrogen lands in there and causes an effect. So we want our estrogen to get in there.
Yes.
Or sometimes we want food phytoestrogens, which have an effect, but maybe not as hard of an effect.
Weakly estrogenic.
But
like flaxseed.
Yeah.
Yeah.
But environmental ones, I've heard that they stay in there.
Yeah.
And they stimulate,
Yeah.
and we have all these hormones around us. We know, like glyphosate was just shown to be a carcinogen. I mean, there are like hormone mimickers out there.
Yes.
So how does that transfer into your practice?
I see it all the time, and it's definitely a part of my all my treatment plans is getting people to cut out these xenoestrogens as much as possible, and people are just not aware of all the places that these xenoestrogens, you know, exist. So that's, you know, getting back to the, you know, how do you know if a doctor is really competent at this stuff? It's like, are they addressing things like that? Because that is going to affect your, you know, your wellness, your health, you know, those xenoestrogens. So, you know, also things like, you know, are they looking at, you know, omega-3 fatty acids? Are they encouraging you to increase your healthy fats? And then, you know, asking them about, you know, how did they get their training in bioidentical hormones? You know, what's their comfort level? And, you know.
So something we should tell our audiences. We're naturopathic doctors, obviously. That's our degree. Gone to school for naturopathic medicine. And I graduated 20 years ago. And I remember back in the day like Dr. Smolinski, my wife, who's also part of our, we also practice with her, like talking about bioidenticals and learning it in school. And now this is like all over the place.
Yeah.
But naturopathic doctors, we're the ones with the history. We're the ones who were doing this back in the days of maybe the mare-based estrogens or the progestins or the non. And there's a lot of study on this. And so I have to say, if I were going to see somebody, I'd see a naturopathic doctor who's rooted in the philosophy, who understands this, who was taught this in school. Not that there's not other competent physicians out there, I'm not saying that. I'm just saying that this has been part of our training since the beginning.
Yeah.
And why? Because it made physiological sense. Science has caught up with that. And so you're extremely well trained, not just because of your training in bioidenticals, but because of the wholeness of how you look at a woman.
Right.
So we had a question come in. This is from John from Wisconsin, and he's asking because his wife asked him to ask. He said, just because, hold on, let me see. If my wife has certain symptoms that she's seen on the internet that says she needs hormones, are there ways to treat those without giving hormones, like a hot flash, like mood changes? And he said, etc. So just because somebody looks up something and has symptoms, maybe they're going through menopause, does that mean that they need a hormone?
Not necessarily. There are other tools. For example, the phytoestrogens can be helpful.
What's that for our audience, a phytoestrogen?
So that is, for example, like a plant-based estrogen. So a food, for example, like flaxseed, which is one of my favorites, that weakly binds to the estrogen receptors. And so you get that sort of mild estrogen effect, but it's much less dangerous than like the xenoestrogens and other things that can attach onto that receptor. So there's things like, and we have a lot of this in the here in our medicinary, but there's a lot of plant and nutrient-based ways to support people through, for example, the menopausal transition.
Ooh, that's a big one. I'm glad you brought that up.
And also I see a lot of perimenopausal patients. Actually, the average age of my patient is 47. And so, there's a lot of women who in the years leading up to menopause are having some of these symptoms. They're having shorter cycles, they might be having hot flashes, they're having anxiety, mood changes, sleep disruption. And so for them, it's a lot of lifestyle stuff. And then, progesterone is one of my biggest friends. Yeah. I mean, because that's really sort of the first hormone to go in the perimenopausal, period. So that's something that can really be supportive.
I live in the world of oncology, and I see people with estrogen receptor positive breast cancer who have been on hormones. I'm not saying that I can say that it's a direct causation each time, but there's an association. We know it. There's a physiological thing. It gets back to when we were doing bioidenticals, pharmaceuticals were not doing bioidenticals, and now we're living in the world of bioidenticals. It's like, what makes physiological sense? Sometimes you can't wait for science to catch up because you have a patient in front of you.
Right.
But it sounds to me like just because somebody's symptomatic or isn't feeling how they want to feel because now they're menopausal or they're premenopausal, some docs are sticking them right on hormones. And they're not necessarily testing about once a year. They're not doing estrogen metabolites in the urine. And I've noticed from the patients that we share, you're doing that all the time.
Yeah.
How important is that?
I'm very aggressive in terms of testing. Like, I want to see if I'm giving you like a hormone, I want to see what's happening in the body because everyone responds slightly differently. So, for example, if you're taking estrogen, people are going to metabolize estrogen differently. So, and people may need different doses of estrogen, right? Like one dose that's perfect for someone, it's too high for another person. This is an issue sometimes I see with people who get pellets.
Pellets.
So
Understood.
I see a lot of patients who, and pellets, some people do great on pellets. I have no issue necessarily with pellets, but I see a lot of patients who come in and they've been overdosed on pellets. And, one dose that was perfect for that last patient is not right for the next one. And with pellets, you can't take them out. So you're stuck with it for a few months. But, for me, I like to check like every month until we get it right.
That's great.
When people are feeling good, when the blood levels are good, I also rely heavily on things like DIM, which is, helpful for metabolizing estrogen in a healthy way.
Okay.
So
you're saying give a dose based on your experience, talk to the patient, measure levels, continue to do that, and then you'll find the right dose.
And then also it's important to remember that, you have to, because estrogen is a stimulating kind of hormone, and it can stimulate breast cells, it can stimulate the cells of the lining of the uterus. So we need to make sure that you, just to be safe, you're getting regular assessments of breast health and pelvic ultrasounds, just to make sure that there's no buildup of the endometrial lining of the uterus. So
I think this has been great. And do we have a question coming in?
Yeah, Diane has asked, do bioidentical hormones help post-menopausal women?
Yes.
So, okay.
Yeah, so I would say the majority of my patients who are on bioidentical hormones are post-menopausal. And, one thing to remember is menopause is a moment in time, okay? And we don't actually know when you've gone through menopause until a year later, because you had to have been without menses for 12 months. This is a little more complicated in women who don't have a uterus, but generally we say 12 months without a period, and then we also are looking at things like FSH and LH and other things other measures like that. But menopausal women, some women sail through menopause and they don't want to do hormones, or they can't for some reason, and that's totally fine. Other women, they hit a brick wall when menopause comes along, and hormones are really, they can be life-saving, and they change.
Life-saving or like quality of life changing?
Well,
sometimes life-saving.
Yeah, people can't function. People get depressed.
Wow.
People can even get suicidal. And
Indeed.
and so and then you have things like bone health and cardiovascular health.
Yeah, it can prevent a fall.
Yeah.
So it really could be life-saving.
Yeah, it could be life-saving and certainly life-changing for a lot of women. So, very, very powerful for the right woman.
Excellent. Great question. Thank you. All right. Well, thank you for tuning in again. And remember, this is Ad Hoc with the Doc. This is Naturopathic Specialist.